วัสดีค่ะ Assalamu alaikum. Good afternoon. So, ladies and gentlemen, partner and friends, I'm Ying Nantawan from Bangkok Hospital, Phuket. Welcome to the exclusive meet and greet with the top specialists for your consumer with Phuket Maraki Hospital and Health Destination. I'm here to introduce our chairman for today. So let's welcome Dr. Kasidit Sisanga. He is General Surgeon's Arabic Medical Supervisor, and he is our Arabic speaking doctor. We're going to welcome you all to this session. สวัสดีค่ะ Dr. Kasidit Sisanga.
Assalamualaikum warahmatullahi wabarakatuh. أنا دكتور كاسيديس خرّاج من الأزهر طب الأزهر ورجع إلى تايلاند ممارس طب في الجراحة عام وبعد ذلك أنا الحين رئيس قسم عربي Arab Medical Service أو MS في مستشفى بانكوك الملكي في بانكوك. أنا جاي هنا في مستشفى بانكوك بوكيت ومستشفى بانكوك سيرود في مشروع بوكيت ساند بوكس عشان يساعد المرضى العربي كله فليتفضل منكم كله أن يسمع منا شو عندنا وبعد ذلك إذا كان في أي مرضى يجي هنا فأهلا وسهلا. أول شيء أول دكتور هو دكتور هيرانياكات دكتور حق الجراح قولون والمستقيم.
Yes. So the first specialist will be Dr. Art Hiranyagat. He is our professor, medical director of colorectal surgery clinic at Bangkok Hospital headquarters and also Bangkok Phuket Colorectal Disease Institute president. And he is American College of Surgeons, Thailand chapter governor, International College of Surgeons, Chicago, USA. And his specialty is colon and rectal surgery and laparoscopic colorectal surgery, robotic colorectal surgery, and surgery advanced colonoscopy and pelvic floor physiology. And with over 100 plus lectures worldwide in 6 continents, in North America, South America, Europe, Australia, Africa, and Asia. So his broad range of colorectal procedures for cancer, inflammatory bowel diseases, benign colorectal conditions, sphincter saving operation, and preoperative abdominopelvic surgery, and also functional colorectal condition such as constipation and incontinence. So let's welcome the first speaker of the day. He's a specialist, and as we said, Professor Dr. Art Hiranyagat. Let's welcome.
Thank you, Kun Ying. Thank you, Dr. Kasidit. Thank you for your kind introductions and welcome everybody to our special sessions for today. I'm going to be sharing my slide. There we go. Can you see my slide?
Yes. We do, sir.
All right, thank you. So I would be really quick on the overview of what we have been doing in Thailand, in particular in Phuket. So I would be skipping all my introduction slides since Kun Ying and Dr. Kasidit have been telling you guys all about it. And thank you for joining us today. We have the variety of services that would be preparing just for Arabic patients, our friends from not too far away, because we nowadays have direct flights from many countries and Arabic areas to Phuket directly. This is the beach in Phuket. As you could see that there are not that many tourists nowadays, which is very good, and you can enjoy the sceneries, the views, and then especially the Thai hospitalities. And at the same time, you can plan for your medical issues, treatments, checkup, and so on. Our institution's been serving in Phuket for 10 years already. And of course, the large intestine is one of the most important organs in our body that would be functioning as to collecting the waste and to empty the waste from our body. And today we're going to be talking about two issues which are, I think, very important, and these issues are very common and very important among Arabic patients. The first topic that I would be touching is about the treatment of the hemorrhoids or the piles. As based on the number from the States, hemorrhoids is one of the most common issues for patients coming to seek for medical attention. There would be varieties of issues regarding to hemorrhoids, for instance, bleeding, pain, lump, prolapse, you name it. So this is the advances that we have been offering to our international patients, including the domestic patients as well. We have all kind of advanced technology to treat the hemorrhoids. As you could see that the most advanced technology to preserve the hemorrhoid and to make it smaller at the same time, because we know that hemorrhoids is very important as to help us with good continence and to give good sensation to the anal canal. We have radiofrequency coagulations. This is the newer technology as compared to laser. This is a very minimally invasive surgery, no incision, no wound, and it could be done as day procedure. And we have THG as well. We have certainly conventional hemorrhoidectomies and band ligation and injections and all the varieties of treatments for hemorrhoids offered here in Phuket, Bangkok Hospital. This is the number of the patients treated with us for 1 year, back in 2019, 117 patients underwent the procedure regarding to the hemorrhoids and the pain after the procedure. This is the issue that most of the patients would be scared about. Pain after the procedure would be less than 3 out of 10. That means the majority of the patients could be done the procedure as day procedure. You don't need to stay overnight, or if you prefer to stay, you can stay only 1 night in the hospital just to make sure that everything is okay. And this is the clinical outcome in details. Male and female, you could see that female patients would have more issues on hemorrhoids. The score for pain would be the majority, 97%, less than 3. That means you can do more day procedure, but nowadays day procedures is occupy about 10% of our services, because our hospital is very, very beautiful as well. The services is very good. So most of the patients would decided to stay overnight rather than going back on the same day, even though the pain is not there. And the outcome for recurrences after a year of follow-up on this patient would be 3%, and the complication rates, including incontinence and bleeding and everything, was a 0 rate for complications. And we also have a spatial pricing or packages for particularly Arabic patients. And you could see that for hemorrhoidectomy could be day procedure or stay overnight in the hospital. It's only 2,000 something American dollar. And the anal fistula, this is another issues, but we put it there as it's one of the common procedure on Arabic patients as well. It's 2,500 US dollars as well. As you can see that it's very, very spatial. And we also including the exclusive privilege for UAE patients who would like to get screened for intestinal tract cancer, particularly colon cancer. Colonoscopy or gastroscopy would be included within a very, very spatial offers as well. Who would be fit for colonoscopy? Nowadays, the American Society, the American Cancer Society would be recommending anybody without any symptoms to come for colonoscopy at the age of 50 or 45. Or if you have symptoms like bleeding, weight loss with unexplained reasons, pain, constipation, change in bowel habit, difficulty evacuation, emptying your bowel, that would be the indication for colonoscopy. And here in Phuket, we would offer colonoscopy as a day procedure with deep sedations, so you don't worry about any discomfort or pain, because our anesthesiologist would be on board as to give an adequate sedations during the procedure. And this is another topic that I think would be the last topic for today for our services to offer you. This is the sphincter sparing surgery for rectal cancer. As you could see that some patients with colon or rectal cancers who suffer with any kind of symptoms seek for the medical attention, and unfortunately they would get the opinion of the surgery that could not spare the sphincters. That would mean patients would be ended up with the colostomy or having the bag for the whole life after the surgery. For our service, we know that this is very important. Quality of life is one of the important issues for cancer treatment. So that's why we concentrate on these sphincter sparing techniques with the team of the specialists who would be here for you to look at your details on the disease and discuss in detail of what's the best possible options for the cure for cancer treatment, at the same time to preserve the sphincters, anal sphincters for the patients as well. And these are the team of the specialists, including the surgeons, the radiologist, and medical oncologist, and those rehabilitation team and nutritional team, and psychologic team of psychology to help the patients with the rapid recovery, and at the same time to cure the disease and to preserve the anal sphincters. So yeah, that's it, would be the overview of our services from Colorectal Disease Institution. I will be ending my talk with the feedback from our patients that we put them into a very short video clip for you. Okay. This is in China. Brazil. Russia. you very much for your time and attention. Thank you. ไม่ได้ยินครับโทษที
نتكلم عن 3 موضوع. أول موضوع بواسير أو هيمورويد. بواسير هو يقدر يعالج بواسير بطريق العملية ربط أو طريق براديو فريكونسي. كل هذا ما في ألم. والمريض إذا كان يجي يسوي عملية 1 يوم فقط بعدين ممكن يخرج ويسوي سياحة ويروح عادي. هذا أول شيء. والثاني هو فحص للقولون عشان نشوف إذا كان في سرطان ولا لا. مفروض ناس عادي إذا كان أكثر من 50 سنة أو في دم يطلع من براز أو في وزن نازل بدون سبب ما في سبب خاصة أو في إسهال أو إمساك يجي ويروح. هذا لازم أنت تعمل كولونوسكوب منظار عشان نشوف هل في سرطان ولا لا. عشان هذا سرطان منتشر. فدكتور يقدر يسوي هنا بدون ألم برضه. والثالث إذا كان في سرطان والقولون والمستقيم ويحتاج عملية دكتور يقدر يعمل عملية وعملية خاصة يسمى Sphincter saving procedure. يعني المسرة في الشرج يكون محفوظ. يعني بعد العملية المريض يقدر يتبرز في شرج بدل ما اللي ممكن شفته من قبله عملية لازم في فتحة في البطن. هذا ما في إن شاء الله. فهذا هو كله اللي دكتور كلم. فأي واحد في مشاكل هذا فضل أن يجي هنا وتعالج مع دكتور.
Very informative, and one word really hit me as I'm a human, I'm not a doctor. So one word, he saved my life. Professor Dr. Artsen Ajagat, it's really bring back the quality of life, and I think the better quality of life is happiness. Thank you very much once again. And let's move to the next specialist. But all of the specialists still there with us for the session, that question and answer at the end after we are talking and meeting our doctor. So the next specialist will be Dr. Narod Tinarong. So he is from Bone and Joint Center, Bangkok Hospital, Phuket. Spine surgeon, minimally invasive spine surgery. So what he is doing?
Dr.
Narod
Tinarong. هذا دكتور حق العمود الفقري والظهري. فسيتكلم عن الأمراض عمود فقري والظهري وإن شاء الله شوف معنا إن شاء الله. تفضل. Welcome doctor.
Welcome Dr. Narod.
Good afternoon, Dr. Kasidik and Kun Ying and all participants, especially our Arabic agents. It's been my pleasure to be here today, and on the behalf of the orthopedic department, I'm proudly present the Bone and Joint Center of Bangkok Hospital Phuket today. So please allow me to start my presentation here. First of all, I would like to introduce our medical service for the orthopedic patient or the orthopedic condition. Basically, I'm glad to tell you that we have collect 10 specialists, orthopedists who have specialized in their subspecialty to cover all your orthopedic condition. For example, you might have injury, you have a trauma, orthopedic trauma, or even you have osteoporosis. We have a special clinic to take care of you. You have a hand disease, hand problem, or even the hip and the knee. This is the most common problem among the patient or even in the Arabic patient. We have a special clinic to take care of them. And currently, within the past 5 years, we established a new clinic to be more specialized for the sport medicine clinic for young athletes or even in the elderly who has been suffering from rotator cuff disease or degenerative shoulder and knee problem, and even the spine clinic to help to get rid of your back pain and improve your quality of life too. I would like to show you the hospital facility first. At our hospital, we have a private standard room and even the VIP room is all private. And for Arabic patients, we also have a prayer room for all of you too. And for the table side examination in our patient, we can perform the ultrasound musculoskeletal diagnostic by our sport medicine or even our hip and knee surgeon, so that we can initially evaluate your condition while waiting for a confirmation with the further investigation such as the MRI or the CT scan. And also, we do have a cutting edge imaging study, the CT scan, which can provide us more useful information in the 3-dimension image or the reconstruction image to make us establish the correct diagnosis, to make us more easier and more precise to provide you a treatment plan for even the trauma patient or even the disease patient. And also, we currently have a gold standard imaging study for the diagnostic of musculoskeletal disease, includes the shoulder, the knee, or even the spine problem. With the MRI scan, we can see everything and we can gather all useful information clinically correlated with your problem, and then we can establish the treatment plan for our patient. And also, I would like, I'm proud to present you that currently we develop our operating room to be more with the cutting edge technology to make our operation more precise and increase the safety for our own patient. We now we use the computer assist navigation, which I would like to show you how it does work in a few minutes. But I would like to introduce you my colleagues first. So basically, our orthopedic department classify into 3 subclinical units. The first one, Dr. Kanisorn, he is our orthopedist and traumatologist, so he can help you about the trauma patient. When you visit Phuket, you might get your body injured. You know, you never know. And if it does happen, you broke your bone. You think about us, we can help you because we have many specialists and our multidisciplinary team here and ready to help to bring you back to your normal status or your pre-injury status as soon as possible. Also, in more complex injuries such as the pelvic injury, we have Dr. Sanchai. He specialized in pelvic and acetabulum injury to help you to fix this complex anatomy and complex injury to bring your life back as soon as possible as well. Again, I would like to show you that for the trauma patient or even the pelvic injury patient, how do we operate our patient and how do we perform the pre-operative planning to make the operation more precise and safely, as I mentioned before. This machine we call the O-arm machine is an intraoperative 3D image. We can gather all 3D image in the operating room right now with less radiation exposure compared to the conventional one or the fluoroscope. With this machine, we take only 13 minutes to obtain the 3D image, and then the surgeon can generate or simulation the picture of the anatomy of the patient, so that the surgeon can see the patient anatomy at the real time, so that they can proceed to the operation. They can insert the metal implant into your body safely. Also, now we are talking about our hip and knee surgeon because the hip and the knee pain is the most major concern that the patient came to our department, hip pain and knee pain might be treated non-operatively initially, but in some stage or some patients who reach the end stage of the disease, they cannot continue their life happily. They could not walk properly. So a joint replacement might be a solution for them. Here we have our team led by Dr. Anupa to provide you a joint reconstruction surgery for the hip replacement surgery or even the knee surgery as well. With the minimally invasive technique or approach, the patient can, after operation within 1 day, you can return or start ambulation. You can start your walking within 1 day and you stay in the hospital for a few days before leaving the hospital. And we have one lady here, the most beautiful one, Dr. Tiyapat. She is our hand and microsurgery specialist. If our patient presents with a hand problem, you have a locked finger, you cannot extend your finger properly, or you feel numbness or tingling at your palm or your wrist area, or even you have the pain around the elbow or your wrist joint, Dr. Tiyapat might be really helpful to fix this problem for you, either with non-operative management or with the operative management. And some operative management for the hand disease or the hand trauma can be performed as a day case. So it means that it's not necessary to stay in the hospital among this pandemic. So it's really useful. And to the next subclinical unit, we developed our sport medicine and arthroscopic center. So we have 3 specialists, Dr. Narod, Dr. Nathawood, and Dr. Vipu, to help you about shoulder and knee and the ankle problem. So if you are young athlete or you are an elderly who suffer from a chronic pain in your shoulder, your knee, or your ankle, this department might be really helpful to help you fix your problem. Dr. Narod and Dr. Nathawood, both of them, they can perform the arthroscopic surgery. The arthroscopic surgery is minimally invasive technique one that they introduce the camera to a very small incision about 1.5 centimeter. Once they can insert the camera port into your major joint such as shoulder or the knee, then they can use the special instrument insert into the joint to repair or reapproximate the tendon, or even to debride the inflamed tissue, necrotic tissue, to fix your shoulder and knee problem. Also the same as Dr. Vipu, he is our foot and ankle specialist. So he can help you about your ankle problem. For example, he has chronic pain at your ankle, and especially the patient who has been diagnosed with diabetes and the diabetic complication with the diabetic foot. So this is quite a late and lifelong consequence. So with Dr. Vipu and our podiatrist and our multidisciplinary team, the endocrinologist, they work together to help you improve your diabetic status and to fix your diabetic wound and bring you back to improve your quality of life at the same time. And the last one, I would like to introduce you our Spine Institute, leading by Dr. Chayut, me and Dr. Chatupon. Here we have our patient who came with back pain or neck pain, so we can treat them either non-operatively and operatively approach. For the non-operative management, we can perform the epidural steroid injection to relieving the pain radiating down to your leg, or we can do the facet joint or the median branch block to block the nerve which has been sent the pain signal to your brain. And for the lifelong or for the long-term pain relief, we might perform the radiofrequency nerve ablation to get rid of your back pain or neck pain too. So I would say that this needle-based procedure can be really helpful, and it can be done as a day case, as an outpatient, no need for hospitalization. But in some circumstances, if your disease or your problem has reached far more stage of the disease, it came to an end stage of disease, and the surgery is strongly indicated, we can perform micro decompression surgery through the microscopic or even endoscopic. This is a minimally invasive surgery, so it can provide you a less pain, less blood loss, less hospitalization, a short hospitalization, and you can early return to function as soon as possible. And if we have to perform spinal fusion, we can perform with the MIS T-leaf or the O-leaf, which has been the current gold standard to perform spinal fusion. And also, if you are osteoporosis patient, you have osteoporotic vertebral compression fracture, we can treat you with a cemented augment vertebroplasty to help to bring you to the pre-injury state too. This is I would like to let you know that in our operating theater that we are fully equipped with the cutting edge technology, include the microscope, which can provide the magnification, the visualization, so we can see your nerve as big as our little finger. Okay, and with the O-arm technology, it can help us navigate to perform spine surgery safely. I would like to show you that during the procedure, we can design the trajectory of the screw or of the implant, and at the same time, we can measure the size, the length of the screw that proper or suit your anatomy. So with this high technology, we can perform the spine surgery safely, and it can provide an excellent outcome for our patient too. This video, I would like to inform you and to show you how the computer assisted navigation or expertise spinal procedures every day are stuck. Critical images in real time to help you navigate procedures from the single level fusion to the most complex. Increased visualization. Instrument choices show we've developed a system that's designed to let you perform. Introducing Stealth Station SA. This powerful system uses automatic registration to intraoperative O-arm fusions. Seamlessly utilize your wide range of navigated spine instruments. With the Stealth Station SA, actively navigate the instrument or configurations of another are changed. What you need. A system designed for the procedures you perform. A system of software, imaging, and instruments that give you the flexibility to do what you need. Every detail is engineered to exceed your expectations. The technology you choose is a reflection of your work. Only the best tools for the best care. You are Stealth. And I can reassure all of you that this technology has been widely accessed and has been increasing its popularity among the spine surgeons in Thailand. In Bangkok, in the famous private hospital like Narod or even Bangkok Hospital Headquarters, they do have this kind of technology. So the procedure which can be done with the O-arm technology, we can do it here too. I can reassure you. And during the pandemic of the COVID-19, so we prepare our medical staff and the process to make you safe while during your stay in our hospitalization too. And that's the end of my presentation, and thank you for your kind attention.
مختصرا كله لدكتور كلب لأنه شوي طويل. دكتور كلم عن قسم العظام حقنا هنا عندنا ينقسم قسم العظام إلى 10 تخصص كمان مثلا الإيد والعمود الفقري والركبة والحوض وحتى دكتور السكر diabetic food أنا عايز دكتور يقدر لذلك دكتور هنا في ماهر في مجاله كثير ومع المساعد من جهاز التقنية الجديد يقدر يسوي عملية بفتحة صغيرة أو minimal invasive surgery ولذلك العملية يكون خفيفة الألم ومضبوط أكثر والنتيجة يكون أحسن في كمان نقطة أنا عايز أركز هو diabetic food clinic لأن إذا كان مريض في سكر وفي التهاب وفي جرح في الرجل عادة اللي يسوي تنظيف ويعالج الجرح هنا عادة دكتور جراح عام أو دكتور الشرايين لأن فكر الشرايين إذا كان زين ممكن يشوف زين بس دكتور أهم على حسب رأينا أهم دكتور في هذا المجال هو دكتور اللي ممكن دخل في مكان فيها التهاب كثير والرجل مختلف من أي شيء ثاني لأنه في عضلات كثير والصديد ممكن يخبي جوا ويعالج بصعوبة فلذلك أحسن دكتور اللي ماهر ويعرف زين في الرجل هو دكتور العظام فأنا فكر بهذا إن شاء الله نظرية أحسن وبرضو عندنا حاجة اسمها مالتي ديسيبلينري تيم يعني مش دكتور واحد يشتغل بس كذا دكتور يشتغل معنا عشان يطلع نتيجة أحسن. Okay.
Also, Dr. Thank you, Dr. Kasidit, for the wrap-up and translation. Besides Dr. Kasidit, who is taking care of your customer who may come, we also have professional translator who understand not just the language, but also your culture. So working with us here at Bangkok Hospital Phuket and Bangkok Hospital City Road. So thank you once again, Dr. Narod. I'm one of his customer, and that word is bring back to the quality of life, bring us back to the normal condition or even better. So I feel so safe living and working here on this island. So thank you once again. And let's continue to our next specialist. He is ready to talk with us. Dr. Sangwon Kunaporn. He is Phuket from Phuket Plastic Surgery Institute, PPSI, Bangkok Hospital City Road, plastic and reconstructive surgeon, and breast aesthetic surgery, and he is also board of directors International Society of Aesthetic Plastic Surgery, or ISAPS. Welcome, Dr. Sangwon.
Hello, salam alaikum.
Walaikum assalam.
I'm very pleased to participate on this webinar, and then welcome to our audience from Arabic world. Welcome to Phuket. As you know, Phuket is the first model of the country of Thailand and of this Southeast Asian to reopen for the international traveler, international tourists in the era of COVID. So it's an island that I think all international tourists, including from Middle East, like to visit Phuket. And this is a good time for me to present all of you the story, the overview of Phuket Plastic Surgery Institute. May I share the slides?
That's right.
Yep. I hope all of you join me these slides. Phuket Plastic Surgery Institute, or we call PPSI. This is the institute that composed of a team of qualified plastic surgeons in Thailand. And this is the photo of our team that we have been in this profession and practice for almost 16 years, since 2006. On the left side of the photo, this is our team photo shot in the operation room of Phuket, of Bangkok Siri Road Hospital in Phuket. Bangkok Siri Road Hospital is a sister hospital of Bangkok Phuket Hospital, and is the hospital of BDMS Group. And next slide will show you that all the surgeons of our team is belonging to the national and international membership in plastic reconstructive aesthetic surgery. And we are the member of the National Society of Plastic Reconstructive Surgeons of Thailand that established since 1976. Also, we are a member of the Society of Aesthetic Plastic Surgeons of Thailand that established in 1985. The two other international society that our team member, all of team member belong to is, the first one is the member of International Society of Aesthetic Plastic Surgeons that established in 1970. And right now I am one of the board of the director of this prestige society that composed of around 4,900 plastic surgeons around the world. Also, the last one that our team membership of is the member of Oriental Society of Aesthetic Plastic Surgeons, or OSAP, established in 1988. PPSI, or Phuket Plastic Surgery Institute, also got some award of our expertise, and we are very honored that we are chosen to be one of the best plastic surgery hospital. Like on the left side, we are honored by the Global Business Outlook in 1920 to be chosen as the best niche healthcare service provider and best hospital for aesthetic plastic surgery. And this year, 2021, we are chosen from on the right hand side, the award from Global Economic magazine that we are the award for plastic surgery best hospital healthcare. The next slide will also echo that Bangkok Siri Road Hospital also approved or accredited by JCI. So this international standard can reassure all the patient, all client of our hospital, either Phuket Plastic Surgery Institute or other department of the Bangkok Siri Road Hospital, that we are among one of the most reliable and high quality of service in Phuket. To give you some idea that Phuket Plastic Surgery Institute are among the member of the International Society of Aesthetic Plastic Surgery. This slide shows that I represent Asia in the board of the director of this prestige society as a parliamentarian. ISAP always present the global survey of all countries in the world, that how many aesthetic plastic surgery procedures done in each country, and they will present around 16 countries in the report, and Thailand's have been proposed in this list for almost 5 years consecutively. And Thailand is one of the top 30 countries ranked by estimate number of plastic surgeons. We have around 420 plastic surgeons, and comparing to the overall plastic surgeon in the world, around 40,000 plastic surgeons. And in Asia, this shows you that Thailand are also among the top 3 countries that our plastic surgeons are member of this International Society of Aesthetic Plastic Surgery. The first rank is to India, that there is around 139 plastic surgeons in India that are member of ISAP. The second country is Japan, around 92 surgeons in Japan are member of ISAP. And the third one is Thailand, that we have around 53 plastic surgeons in our country to be member of ISAP. And you can see that the rest of the countries, Philippines, Taiwan, South Korea, Indonesia, even Singapore, China, Bangladesh, the member of the plastic surgeon in those countries have less member than Thailand in ISAP. Talking about medical tourism, I'm quite positive that you might know that Thailand is one of the top 5 countries that the medical tourism is very, very popular. This slide ensures you that this Thailand rank in the top 3 countries of most frequent country for foreign patients. Then come back to PPSI. What are we stand for? We stand for patient safety. Patient safety, this is the diamond of patient safety, that there is a 4 facet that we very concentrate on when we deal with the plastic surgery procedure. First, the patient. The second is the surgeon. The third, procedure. And the fourth one is facility. I like to clarify what about the detail of patient safety that is the priority of Phuket Plastic Surgery Institute. Procedure. We need to do procedure that appropriate to the patient. We will talk about what the patient look for, what the patient asks for, and then just that this is appropriate or not. If we found that the patient might not have the good knowledge or clear understanding about the procedure that they look for, we will try to explain carefully. And if that patient might be not realistic or have misunderstanding about the procedure that they look for, we will try to explain until it's clear that they are fit or not fit with that kind of procedure. The second facet, the patient. Is that patient a good candidate for the procedure or not? Some candidate might have a lot of underlying disease and look for very complex surgery that may be too risky. So we explain the list and try to compromise, but we will not take the patient to the risk of complication. The surgeon, as I explained in the beginning, that all of our team surgeons are qualified plastic surgeons and very experienced in the field, that they have experience and expert. All the surgeons are member of the National and International Society of Aesthetic Plastic Surgery. And the last one is the surgical setting of facility. As as you should know, Phuket Plastic Surgery Institute located in the hospital. We are not standalone plastic surgery clinic. So we have a lot of staff in other fields, medicine, surgeon, OBGYN, X-ray that work together with us to make sure that our surgical setting, including the anesthetist for sure, that we will work with all the experienced medical staff because we focus on patient safety. This slide shows the sample of the leading aesthetic plastic surgery that we give the service to our client. Starting from aesthetic breast surgery, is all kind of aesthetic breast surgery, either make the breast bigger, or we call augmentation, or some patient, some client have very, very large breast, and is a burden of the patient on daily life, sport, choosing the clothes. So they might need breast reduction in contrast to breast augmentation. Some patient might just have children and the breast shape is deformed because it's sagging. So we can offer breast lift or mastopexy to return the good shape of the breast to this kind of patient. And the last one that PPSI have very, very welcome from clients around the world is about the revision of aesthetic breast surgery that the patient failed from other clinic. So we have done a lot of revision breast surgery here too. The second category is about the body contouring, liposuction, liposculpture. We sucking the fat out. We fill the fat in some part, suck from some part and fill on another part. Or even abdominoplasty, like a surgery to remove the excess tummy skin along the lower abdomen, because the patient might just have children and then the skin along the lower tummy is very loose and excess. So we return the good figure, the good shape of abdomen to this kind of patient. Bariatric surgery. Some patients suffer from overweight, very bad obesity. So to correct the cause of obesity, we offer bariatric surgery like a gastrectomy. This is also one of the most popular surgery, and we have very good surgeon on doing the bariatric surgery at Bangkok Hospital. The last other is facial rejuvenation surgery, including eyelid, face or neck, rhinoplasty, about the nose surgery, female genital rejuvenation surgery, vaginoplasty, labiaplasty, and also botulinum, filler injection, laser, radio frequency resurfacing. This is some of the picture that show to the patient from our website that what we offer to body contouring, facial, breast either. Phuket Plastic Surgery also held many regional and international academic meetings. This video shows that before COVID, we held one of the breast aesthetics excellence workshop in Phuket, and we invited renowned surgeons from Europe and America to be our guest speaker. And we also relay the signal from Bangkok Hospital to the meeting room in Ramadan Hotel. This is one of the brochures that we used to distribute last year. That's the left side of the photo show the environment in our hospital that we have a surgery and then send the signal to the hotel online. This photo show about the Miss Grand Phuket beauty patient that PPSI is one of the major sponsorship of this kind of beauty patient, and we invite all the candidates of Miss Grand Phuket to our institute, and then they will experience what we have worked here. We like the left bottom corner that we use the 3D simulation to help the lady select the good or proper breast implant for her. Phuket Plastic Surgery Institute also have appeared in many international document film. Like this one, Operation Thailand from Australia. They very interesting why so much Australian people fly to Phuket for aesthetic plastic surgery. So they do a series about what happened in Thailand, and the name of the series is Operation Thailand. This is another series also. It's called What Really Happened in Thailand. This is about the aesthetic plastic surgery service that we offer to the international patient. So I'm thank all of you that sacrifice your time to listen that what we have done in Phuket, and hope that we can offer a good service to all the patients from Middle East very soon from now. And if you still have any question, I'm still here to answer all the questions. Thank you.
Thank you, Doctor. أنا ممكن أتكلم شوية عن هذا معهد الجراحة التجميل والترميم في بوكيت. من أول أنا ما أسمع هذا من قبل، بس لما أنا جاي هنا ورحت وشفت بنفسي وجدت أن هذا المكان تمام زين. في دكتور ماهر موجود كثير بدرجة عالمي، وفي مرضى حتى من عالم يجي كله، حتى في أستراليا يجي هنا عشان يعمل عملية كثير. حتى هنا في أستراليا يتعجب ليش المريض من هنا يجي إلى هنا. ودكتور برضو كلم عن خط العلاج في الدكتور كله. دكتور يقول إذا كان سوي عملية لازم في سيفتي. أهم شيء هنا هو سيفتي، لازم ما في أي خطورة للمريض. وأنا أفكر هذا مهم جدا جدا، لأن سامعنا كثير المريض يروح إلى كلينيك صغير سوي عملية وبعد ذلك حصل مشكلة وفي ناس يموت أو في ناس يتعود أو في أشياء كثيرة صار. فلذلك هذا معهد موجود في مستشفى سيري رود، فهو مكان مناسب. إذا كان في أي شيء حصل المستشفى كبير ممكن يتغطى كل شيء. والثاني الدكتور اللي يعمل كله يفكر عن مناسب عملية للمريض. لازم يشوف المريض أول ويختار مناسب للمريض، مش أي شيء المريض يبي يعطي، بس هو لازم يشوف اللي أحسن للمريض، يناقش مع المريض، وبعد ذلك في جهاز كله كافي، ولذلك يطلع نتيجة زين. وهو أحسن مكان لعملية تجميل في هنا في العالم كله الخير. أوكي، شكرا دكتور. وبعدين إذا إن شاء الله في المستقبل هنا سنكلم واحد عن كل شيء. نعم.
Yes. So yeah, I assume that I understand everything exactly. And I like that word. Normally I'm thinking about be safe. and come back to the normal condition. But Dr. Sangwon just mentioned, be beautiful and safe. So it's better, not just safe, but beautiful as well. So we come to the last session should be like any question from the floor, and our specialist is there. At the beginning, I thought we're gonna meet just 3 specialists today, and including Dr. Kasidit, but actually we met more than 30 specialists from each department, each institute and academy. Today, over 30 specialists, and we're actually ready to serve all of you. And is there any question from the floor? Anyway, we have using the time for over an hour, and very informative and hard work for Dr. Kasidit as well to translate everything for us. As we promised, we have the professional translator here to understand and be ready to serve you besides Dr. Kasidit, and also the team, the professional team at Bangkok Hospital Phuket and Bangkok Hospital Road. So we are ready to serve you, and even during this period of time, it's not difficult to step in coming to Bangkok to Phuket Island. I mean, under the policy of sandbox, just communicate with your agent, just communicate with one of the team who always answer all questions that you request, and we are ready here. Yes. So I think right now the question is not there yet, but if the question is there, we will send and deliver the message to the concerned specialist, and we'll get back to you. Okay. I have to say once again, thank you, Dr. Kasidit Sisanga. So the general surgeon, Arabic medical supervisor, and Arabic speaking doctor, and Professor Dr. Athiran Yagat, Colorectal Disease Institute, Bangkok Hospital Phuket, and colorectal surgeons, minimal invasive colorectal surgery, Dr. Narod, the Narong Bone and Joint Center, Bangkok Hospital Phuket, spine surgeons, minimal invasive spine surgery, and the last one is Dr. Sangwon Kunaporn, Phuket Plastic Surgery Institute, PPSI, Bangkok Hospital Road, and plastic reconstructive surgeon, breast aesthetic. And thank you, everyone. Thanks for your time. And we wish that we will have opportunity to welcome your customer here and come to us. I think not just only to be safe, to be beautiful, but our island is also very beautiful. We are here sitting at one of the landmark of Phuket Island, Promtape Cave, and you have to come and see it for real. Okay, thank you very much for today. And I'm Ying Nantawan. Thank you, Dr. Kasidit. Okay, thank you, everyone. Thank you, doctor. And please send us.
Thank you. Thanks for all
สวั
for
สดี
having us.
ค่ะ
ขอบคุณมากครับคุณหญิงและก็อาจารย์กสิเดชนะครับ